Hello everyone, welcome to the Medic World Study with Dr. Mahi. Today we are going to discuss the previous year questions of anatomy from AIIMS 2017. So let's start with our first question, that is nucleus pulposus is derived from. Here in the image we can see the structure which is marked as 1 is the notochord and nucleus pulposus is derived from notochord. So the answer to this question is option A, that is 1. Now next question, what is the origin of the fibers marked by the arrow? First of all, we have to identify the structure marked by the arrow. Here, the structure which is marked by the arrow is the fornix, and it arises from hippocampus and ends in mammillary body. So the answer to this question is hippocampus. That is option A. Now, next question. Among the following, what is the function of the marked muscle? The muscle which is marked in the above image is the lateral pterygoid. Here, the muscle which is marked is the lateral pterygoid, and its primary function is depression of the mandible, that is, opening of the mouth. So, the answer to this question is option A. Now, the next question, which of the marked foramen does the mandibular division of trigeminal nerve pass through? Let's see the image. Here we can see that the mandibular nerve passes through the foramen ovale, and in the image it is marked as A. This is the foramen ovale and it is marked as A. So the answer to this question is option A, that is A. Ovale, foramen ovale. Now the next question, the structure marked with the asterisk in the electron micrograph indicates. Here, the structure marked with the asterisk in the electron micrograph indicates the presynaptic secretory vesicles. The structure marked with the arrowhead is the postsynaptic density. So, the answer to this question is C, that is secretory vesicles. Now, the next question. In the given image below, identify the muscle responsible for the opening of the mouth. The same question is repeated in another way. So, first of all, see the image. Here in the image, we have to identify the muscle which is responsible for opening of mouth, that is the depression of mandible, and the muscle responsible for it is the lateral pterygoid, and the muscle which is marked as B is the lateral pterygoid. So the answer to this question is option B, that is B. Now the next question. Identify the structure passing through the foramen marked. Let's see the image. The foramen, which is marked here, is the superior orbital fissure, and the abducent nerve passes through it. So the answer to this question is option A, that is abducent nerve. Next question, the talocalcaneonavicular joint is a type of joint. So the answer to this question is option A, that is ball and socket joint. It is a fact-based question, we have to learn it. Next question, which of the following is connected to the structure marked as A in the image below? Let's see the image. The structure which is marked as A is the splenium of corpus callosum, and it is connected to the striate cortex. So the answer to this question is option C, that is striate cortex. Now the next question, the structure passing through the central tendon of diaphragm is. The inferior vena cava passes through the central tendon of diaphragm. So the answer to this question is option C, that is inferior vena cava. Next question, shape of trapezius muscle is. The answer to this question is triangular, because trapezius is a broad, flat and triangular muscle. Now the next question, all of the following are true about gray rami communicants is all, except we have to find the wrong statement because it is asking except. Unmyelinated, yeah, it is the true statement. Connected to the spinal nerves, it is the true statement. Preganglionic, No, it is the false statement because gray hemicommunicants are not preganglionic fibers, they are postganglionic fibers. So the answer is C. Last option, present medial to the white hemicommunicants. Yes, it is the right statement. Next question, which of the following represents the holocrine gland? Let's see the image. Here in the image, this image which is marked as B, this one is the represents the sebaceous gland and it is the type of holocrine gland. So the answer to this question is option B, that is B. Now next question. Which of the following structures marked in the below image gives rise to the heart in the adult? Let's see the image. Here the structure which is marked as C in the above image depicts the heart bulge. So the answer to this question is option C, that is C. Next question. A 58-year-old woman undergoing cholecystectomy. During the procedure, the resident accidentally advanced the scissors along the superior border of epiploic foramen, causing injury. Which of the following structures is likely to be injured? We all know that the epiploic foramen superior border is formed by the caudate lobe of liver, so it is the likely uh, injured structure. So the answer to this question is option C, that is caudate lobe of liver. Next question. Which of the following structures does the cell pointed by the arrow inhibit? Here, the cell which is pointed by the arrow is the Purkinje cell and it inhibits the deep nuclei in the cerebellum. So the answer to this question is option D, that is deep nuclei of cerebellum. Next question, the image below shows the insertion of transversus abdominis muscle. Identify the conjoint tendon. Here in the image, the structure which is marked as C is the conjoint tendon. So the answer to this question is option C. Let's know some facts about conjoint tendon. It is formed by the lower fibers of internal oblique and the lower part of aponeurosis of transversus abdominis. It is attached to the pubic crest and extends to a variable extent along the pectineal line. Now next question. What represents the marked area in the given histology of lymph node? Let's see the image. The area which is marked here is the mantle zone of lymph node. So the answer to this question is option D, that is mantle zone. Next question. Young patient presented with hypoparathyroidism, absent-thymus, and tetany. Which of the following marked are in the image is defective in the given condition? First of all, we have to identify the clinical scenario here. The clinical scenario is suggesting hypoparathyroidism, absent-thymus, and tetany. It's all suggests towards the DiGeorge syndrome, and it is caused by the defective development of third and fourth pharyngeal pouch. In the image of pharyngeal pouches that is given, 3 points to the thymus. This one points to the thymus. Since in the above question the thymus is absent, option 3 will be the most appropriate answer. So the answer is C, that is 3. Next question. A patient came with complaints of inability to move his fourth and fifth digit, cannot hold a pen, and he was not able to hold a paper between the fingers. Which of the following sites given below is the probable cause of injury to the nerve in question? The given clinical situation suggests an ulnar nerve injury, and the most likely site would thus be the medial epicondyle, and the medial epicondyle here is marked as C. So the answer is option C, that is medial epicondyle. Next question. Which of the following structures of the scapula is palpable in the infraclavicular fossa? We all know that in infraclavicular fossa, the structure which is palpable is the coracoid process, and here in the image, the structure which is marked as A is the coracoid process. So the answer to this question is option A, that is A coracoid process. Identify the pelvic diaphragm in the picture given below. In the picture here, the pelvic diaphragm is dis- depicted as point A, which is the levator ani muscle, which is a part of pelvic diaphragm. So the answer to this question is option A, that is A. Next question. What is the root value of cremasteric reflex? The answer to this question is L1 and L2. That is option A. We have completed all the questions from AIIMS 2017 of anatomy. Thank you so much.